This is Tin Green, and today we have Charlie Rodriguez from Core. A quick bio about Charlie. He initially focused on T1 sales. He now specializes in intricate IoT and mobility solutions at Core. Charlie is dedicated to being his best, driven by a strong commitment to his family, employer, and community. A significant part of his professional journey includes 10 years with Comcast Business, where he helped them launch and build the channel from the ground up, leveraging his extensive cable, fiber, and SD-WAN expertise. Today, he enjoys his work at Core, finding it exciting to sell amazing technology in the mobility and IoT space. Charlie approaches life with a one step at a time philosophy and maintains sanity by having a clear understanding of the difference between what I can control and what I can't control. He actively manages his well-being by waking up early, exercising regularly, and watching what he eats. Welcome, Charlie. How are you?
I'm well. Thank you so much. I appreciate that. You mentioned, T1s. I'm sure folks listening will know that that takes me back to about 20 or 25 years that I've been in telecommunications because that's what we were selling back when I first started in telecommunications.
Yeah, yeah. So let's get it started.
Yeah.
So, based on your personal experience,
hmm
how have those experiences shaped your resilience approach to life and your continuous drive to best help you and those around you, both professionally and personally?
That's a good question. I guess going back to the what I can and what I cannot control conversation,
Hmm.
that goes back to, I guess, some history and some hard life lessons that my family and I went through many years ago. We lost our oldest daughter to cancer
Oh no, I'm so
back in
sorry.
yeah, thank you. Back in in December of 2016. It was Christmas Day.
Mhm.
And prior to that, I had struggled with alcohol abuse, and so I was able to get help, find sobriety, be in a space in my head where I was sober and present in that tough situation in our lives, where I was able to really, go through that tough time with my family, be there for my other surviving children, and again going through rehabilitation and surviving that and finding sobriety. I've not had a drink since September of 2016.
Congrats.
Yeah, almost 9 years sober. So thank you for that. And so through with that came a lot of therapy. I'll be
Mhm.
honest with you, Finn. I went through about a year of therapy during that process, to help me stay sober, live clean, and also to get through that hard time in our lives of losing our oldest daughter to cancer. And that those struggles and overcoming that was challenging. And I think when life kicks you in a situation that's so hard and you're able to come back from that, you learn a lot in life. You become a different person going through experiences like that. And there are some blessings that came from that. I know it's hard to think of a blessing coming from losing a loved one that's that close to you, but she also left us her daughter, which is our granddaughter. So we've been
Mhm.
raising her since she was 2.5, 3 years old, and she's now 11. She's my little girl, and she's a blessing, and she's allows me to push hard every day, do the right things every day, keep my sanity every day, and brings me a lot of joy. So
So you found
big
a
big
silver
motivating
lining.
factor. Yeah, big motivating factor and silver lining to your point then.
Yeah. Oh, that's awesome.
Yeah.
So, also in your personal experience, in your bio, you mentioned that you were a translator for your mom when you
Oh
were
yeah.
younger. And with that, you were able to learn how to communicate very well and also learn all the listening skills, right, from that. How do you believe this early experience contributed to your ability to tell compelling stories and ignite curiosity to your listeners in discussing complex products and services?
Oh, that's so neat. You pulled that out of my bio, and that my mom was she became an American citizen, but she was from Mexico.
Hmm.
I was born here in the United States. She spoke very broken English when I was young and growing up, and so when I was little, and I'm sure my brothers and sisters before me had also helped translate for her, but when it came to be my time when I was 9, 10, 11, 12 years old, when she was either buying a car or buying furniture or dealing with the financing at the bank, whatever she did, in that at that point in my life was her translator. So I would
Mhm.
join her, and I would really, whatever she was telling me, I would convey to the folks that she was talking to. They would tell me the transaction, the cost, the finance, this, whatever it was, they would tell me, and I would translate that to my mom. And she was quite a character. She, even though she spoke broken English, she was always bright, funny, witty, and would always bring joy to every conversation. So a lot of that rubbed off in me.
Oh,
I,
yeah,
I,
I
I
can see that.
hope. Thank you.
I can see that.
Just, I think being that young and speaking to adults and having to be very clear about what's being said gave me the skill set to really, in this complex world of IoT and telecommunications, being able to bring I guess the complexity of those conversations to where I can explain things in a very simple way and make them very understandable and clear for
Yeah.
everyone to understand. So I think all of that experience as a kid helped me become, very good in the sales environment where I think I'm pretty relatable to a lot of folks. I can communicate well. I can take complex things we sell and simple them down for our customers to understand. And I think that was a great experience for me. And again, a lot of her joy just, rubbed off on me. And I think I carry some of that with me every day that she's no longer with us. But yeah, thank you for pulling that out. That's great memories back in those days. Yeah, a
Yeah,
lot
that's
of fun.
good. That's good. Yeah, I can see her joy in you, like how it rubs off. Because every time I talk
Thank you.
to you, there's always some kind of joy or some kind of lighten up mood. You're always like, yay, like it's good. It's good.
Thank you, Finn. I appreciate that.
So now let's talk a little bit about Core. K
Oh,
O
yeah.
R Core as CORE, but Core, the company that you work for, and tell me a little bit about the services that they provide in the healthcare industry.
Absolutely. I've been with Core almost 6 years now, and
Mhm.
initially when I started with Core, I helped build the channel here for the first 3 years.
Mhm.
There was an opportunity to join our connected health team, and I jumped at the chance. It was a chance for me to learn a new product set. What most people don't realize is Core, we have a thriving healthcare business here at Core Wireless. It's literally a $100 million a year practice for us here. And so I spent 2 years on the connected health team learning how we support healthcare organizations with remote patient care monitoring solutions, clinical trial solutions. It's a combination of deploying kits with gateways and peripherals that all have to talk to each other. You have to have connectivity. You have to ensure these devices work because we're talking about people's health, and you can't have devices that don't work out there because people's lives and their health is at stake here. So we have to ensure that these devices work in the field. When they're done with those devices, you can't just throw these devices away. They have to be returned, clean, sanitized, disposed of to FDA standards. We have those services here at Core. We offer full life cycle management services, third-party logistics services that manage all of these solutions here at Core Wireless. And I think that's something that a lot of people don't know here, that we
Okay.
do it very well
Okay.
at Core.
Okay. So now, what kind of devices are you speaking of? Like, what are
Okay.
the things that would be utilized in that package that you guys would
Yeah, great question, Finn.
provide?
So first of all, you would need a gateway, a device that, traditionally you would be like a router type device in the old days. Today, devices are literally tablets that look like cell phones.
Okay.
But they're purpose built. We set them to kiosk mode, so they only do what they're allowed to do, which is mobile device management, healthcare applications. They're not really made to watch Netflix or chat with your friends on Facebook. That's not what they're meant to do, and they don't do that. So
Mhm.
that would be the first part of the puzzle, right?
Mhm.
Then you would have the peripherals. In the case of a remote patient care situation, you would have a blood pressure cuff, a scale, heart rate monitoring. All of the devices you'd expect to see in a doctor's office will now be in your home kit that a patient or a participant can sit at home, have this kit, have a visit with a doctor face to face, like I'm talking to you today, and the doctor is now saying, "Hey, Charlie, go ahead and stand on the scale. Let's check your weight." And the minute I stand on the scale, that data is transferred immediately to the doctor's computer or his desktop. So
Wow.
he's looking at that data. Go ahead and let's put on that pressure cuff. Let's go ahead and test your blood pressure. I'd put on the cuff. I'd set the machine. He or she is watching this happen in real time and getting that data instantly efficiently. So literally, Finn, all of these peripherals communicate to this gateway via Bluetooth.
Mm-hmm.
And so, in essence, a patient or a participant can have a visit with their doctor or physician in their home with all of these peripherals you'd expect to see in a doctor's office. And those devices and kits are what we're good at putting together for healthcare organizations.
Wow, that's amazing
Hmm.
technology. Like we've come a very long way.
Yeah,
So
incredible.
let's see here. The this technology, I'm quite sure that during COVID, it
Hmm.
was very well put to use, I would say.
Then you hit the nail on the head because during COVID, what happened was we all were in lockdown.
Yeah.
And all of a sudden, people that needed to go see their doctors could not do that. And so our business exploded. Immediately, every healthcare organization in the world needed remote patient care kits that they needed to deploy.
Hmm.
And what Core was able to do was we were already doing this for large organizations. We've been doing this for years for other large healthcare organizations. So for us, it was just taking new orders from new organizations that needed these kits deployed as soon as possible. So our business exploded and boomed in the healthcare space and remote
Yeah.
patient care. And what's interesting, Finn, is what most people found is that you can have effective doctor visits with all the tools at home without having to drive to go see your doctor, having to take time out of your day to drive across town or deal with traffic and have those visits, and they're as effective and fruitful as if you were in a doctor's office. So it exploded during and post COVID. And then what healthcare organizations realized is the value and usefulness of these RPM kits in other areas. When hospitals administer, say, a surgery, someone's in an accident, or they have knee surgery, they have hip surgery. It used to be in the old days they would go home and they'd spend about a week or two in the hospital healing, and then they'd get sent home and they were fine. That doesn't happen today, Finn. Healthcare organizations send folks home 3, 4, 5 days after a major surgery. And the challenge that hospitals have is if anything goes wrong with those patients or they have to readmit them into the hospital because they're not healing properly or something goes sideways, and 2 weeks later, because they were sent home too soon, they have to readmit them. If they have to do another surgery, the second surgery doesn't cost any less than the first surgery. So say,
Right.
for example, the first surgery was $300,000. Real actual costs. I know this for a
Hmm.
fact. The second surgery or the second time they have to open someone up to repair or fix that patient is no cheaper. It's another $300,000.
Right.
So the payers, the healthcare organizations and the insurance companies and the Medi-Cal and Medicare folks, they're going to basically say, we're going to pay you for the first operation, but
Hmm.
because you didn't deliver proper care post that surgery, we're not going to pay for the second operation. So in essence, the hospitals have to eat that cost.
Yeah.
So now when they send a patient home post acute care or treatment or trauma and operations, they're now sending them home with these kits. So now they can monitor the patient at home, make sure their temperature is fine, make sure nothing's going wrong. And if something does go sideways, the doctors and physicians are getting a notification to let them know that, hey, we need to see this patient before it gets any worse. And they can bring them in. Maybe it's just a simple medication application of some penicillin to eliminate a fever or eliminate an infection so that they heal fast. In essence, getting ahead of a second operation with a patient saves hospitals millions and millions, maybe even in the tens of millions of dollars. So what hospitals realize is it's a small investment to deploy these kits initially post-surgery to avoid a readmittance and saving them millions and millions of dollars. So
Yeah.
that's the value that they found in these kits and these RPM solutions that we're able to deliver for them today. And they're using it today. Many folks you'll run into today after major surgeries, they're coming home with these kits and they're like, yeah, it's great. I got a thermometer, I got a temperature gauge, I got a scale, I can have a visit with my doctor, and I can talk to them via this gateway they gave me. And those are amazing solutions that are happening today. It's the future of medicine today.
Yeah. Absolutely. I can see it.
Hmm. Yeah.
And also, it would be good in the application of the rural areas, right? Like driving, like if the nearest hospital to you is an hour or even 2 hours away from you, and you have a medical condition that you need to go to the doctor often, that would save a lot of time on the patient side from going and driving in either traffic or, you know, even in the way early in the morning or late at night, depending on when the appointment is, and how far the place is.
Absolutely. I mean, I envision the future that every household will just have these kits and peripherals and tools available at any time so that in that situation, someone's not feeling well. I mean, we do it today. It started with Doctor on Demand years ago. But,
Hmm.
I've used Doctor on Demand when it first launched, probably 8, 10 years ago. But back in those days, then it was literally you would talk to a physician on the phone
Hmm.
and they would say, open your mouth and gargle, and you'd hold your mouth open, you'd hold the phone, and they're looking down your throat just with the phone. That's not effective. That just was not a valuable solution. So to your point, I can see a world where everyone's going to have the actual thermometers and scales and devices and peripherals and gateways just at home so they can always have access to a doctor with all the right tools as opposed to just a phone back in the old days.
Yeah. So you would see it how like your primary care physician would give you like when you're a new patient, it's like, hey, here's the kit, keep that on hand, and then whenever you want to see me, we can either have a virtual call or a virtual face-to-face video call, and then we will take your data, and then that way we can talk about it, how you feeling and all that stuff, so it avoids the drive in for the patient, and then the doctor can also take more patients in, right? So there's less waiting in for the patient and more, I guess, more productivity for the doctor.
Yeah. Well, think about it. How many times do we go to the doctor's office and you have an appointment, say it's 10 o'clock in the morning, and you get there at 9:55 and you wait, and guess what happens? Sometimes they're late. Sometimes you're there 30 minutes before they see you.
Yeah.
So now imagine if you're having that same doctor's appointment in your own home. Guess what? At least you're home and you can do things in your own
Yeah.
home before they pop onto the phone and say, "I'm ready for you, ready to see you." So
Yeah.
there's a lot of different little things. Yeah, I didn't even think about that aspect of it, but that's a great value just alone.
Yeah, and also for kids, little kids when they're sick, especially for new parents,
Mm,
when they're home and the baby has spiked a fever, or even
yeah.
just a little, just something that they're worried about, they can just pop up on an app or something like that and ask questions easier, that and then have the data, right, to be connected to the doctor and be like, hey, the pediatrician can see, okay, well, this is the trend that's happening with the kiddo, and then
Hmm.
that way the doctor can be more in tune with the kid's health
Oh
also.
yeah, absolutely. Listen, my wife and I, we had little ones when, and that fear and doubt when your kids are sick and you don't know what's going on, to
Hmm.
talk to somebody and to have tools to take their temperature and give that information to the doctor instantly would be invaluable. And we didn't have that when my kids were little, but I can see such value in that because it takes some of the fear away because it's your kids and
Yeah.
listen, I know personally,
Yeah.
nothing like when your kids are ill, you can't fix it.
Yeah, you feel so nervous, and I know when my kids were little and the first time they were sick,
Mm,
or they looked like they were sick, I was like so nervous, and then I didn't know what to do.
yeah,
And then you're like, I might need a thermometer, but now I need to run to the store
yeah,
to grab
oh
one. So
yeah,
like just imagine if the pediatrician gave you that kit already as, as the first time patient, you have that kit already, then you're prepared,
hmm,
right? So yeah. Yeah. So we talked about a case study, which I'm gonna link in the description, of course. That case study was with the West Virginia opioid, am I correct? Situation with Crave Alert. Tell
correct.
me more about that.
Yeah, no, absolutely. So these are things we've been able to expand. Initially post-COVID, our PM solutions were really just about doctor visits and having all the tools in your home. But, there are so many other use cases, and this is a great example. As we all know, opioid addiction is a struggle, and it's gotten out of control. There are millions of people that struggle with opioid addiction today, and West Virginia has been significantly impacted. Some of these rural towns just are hit the hardest. So there's a group, the West Virginia SUD. It's a group that is really looking for a solution to help folks recover from opioid addiction. And they approached one of my partners, a company called V1. They're based here in California, but they have locations throughout the country. V1 is an RPM company, but they came across this need in West Virginia for this group to that was struggling. Like they needed to find the right tools that they could send home with these folks that are really trying to recover from addiction. But what tools did they need? So V1 got involved. They created their Crave Alert program, but they needed tools and equipment. They needed a gateway. They needed tried consumer grade devices. That was a struggle. They needed connectivity that they could count on because some of these rural towns, there's not many choices for coverage if you're up in the hills in West Virginia. Towers are very rare. They needed devices and patches to monitor the opioid recovery participants to ensure they were in a position to know what was happening if they were struggling with a moment in time where they needed a help, they needed intervention from a program or a case manager. But how do you put all those together? So they reached out to us. We started researching some of the tools and devices that we could source, and also the logistics of shipping and kitting. And little by little, it all came together. So they were using some of the challenges where they were using consumer grade devices. Well, you can't control the operating system. You can't control firmware updates. If Apple or Samsung decides that that device needs an update, sometimes that causes devices to crash in the field. Well, you can't have that if someone's struggling with addiction and they're about to fall off and go do some more drugs. So you need something that's a device that you can count on. Number one. Number two, connectivity. You needed ubiquitous connectivity. You have to make sure that the device is connected no matter where it's at. And the third part was sourcing and putting together all those devices. So together with V1, we found that we worked with a company called Social Mobile. They build purpose-built devices. So now we had a device that was not consumer grade. It was built for business only. Doesn't have any bloatware. They're Google and Android certified gold partners. So they're quality devices. They've been in business for 15 years or longer. And they build purpose-built devices. So now we knew we had a device that we could count on, that we could control the operating system and control firmware updates. So that was done in that set. So we got the device. Then they needed a patch or a device that was a wearable device that the participants could wear for 7 days in a row, waterproof, wet-proof, that would take their temperature, monitor their vitals, their heart rate, their skin temperature, their temperature overall, blood pressure. So they needed a device. So we're able to source that through a company called VivaLink. Then with connectivity, we were able to provide them with our core OmniSIM. It's an eSIM. It's a multi-MZ, multi-IMSI SIM. That basically means it can connect to all the major carriers in the United States, T-Mobile, Verizon, and AT&T as an example. So that eliminated the coverage issues. And then they also needed someone to be able to put the kits together, make sure that the Bluetooth devices were connected to the gateway. All the peripherals had to work and communicate together. They had to be tested before they were shipped to the participants. So we were able to do that for them through our logistics group and program here at Core Wireless. So now we're able to get the gateway, source the patch, provide GPS services through our position logic services, put in a mobile device management application so that the devices were in kiosk mode, which means that they're only used for what they're supposed to be doing, put them in a box and a kit, ship them to this group that could actually put them on the participants individually. When that participant is done after the 7 days, those kits would come back to us. So that's the kit and the solution that we're able to provide to the West Virginia SUD. And it's proven successful because what we saw was a 67% reduction in stress and anxiety alerts. If there were stress and anxiety alerts, there were notifications sent to the program managers or case managers that could pick up the phone and say, hey, Finn, I'm a little concerned. I see your blood pressure's high. I see your temperature's gone up. Tell me what's going on. And all of a sudden that phone call through someone that's recovering from addiction and needs help, that intervention helped them come to some peace, ease, bring them off of the shelf, Finn, off of the edge, the ledge, right? If
Right.
they're about to go try some drugs, that phone call, that intervention would give them a break, make them think, pause, and now you're talking to somebody that can stop them from going out and trying drugs.
Wow,
So
that's amazing.
it's amazing, and they've seen a 20% reduction. It's growing, it's getting better, and now they're looking to deploy it even more throughout West Virginia. So it's a successful case study through a partnership of multiple organizations, Finn.
That's amazing work.
Yeah.
Amazing.
And again, it began from RPM solutions, but thinking outside of the box of what else can these tools be used for.
Mm-hmm.
and just an amazing solution that's helping people. And at the end of the day, then I think that is the most important thing. What are these devices? What are these gateways? What's this connectivity? What does it all do? It's about humanity. It's about people struggling through life. And if we can create a solution that helps people get to normalcy, get back into the world, save them in situations from struggling, losing their family members, losing their careers, I think that's the best value we can bring to anyone is the human part of these solutions.
Yeah, absolutely. I totally agree. Absolutely. That's a great solution for it's a great application to said solution. All right. Here in you have mentioned well, I've mentioned earlier your philosophy of understanding the difference between what I can control and what I can't
Hmm.
control.
Yeah.
How does this perspective guide you in your daily work within rapidly evolving technology field like IoT, where unforeseen challenges happen a lot?
No, it's true. Again, it's the art of the doable. Sometimes, some of these projects we work on or we hear about from customers, and oftentimes there's a lot of science project thought processes in IoT. Um, you know, what I like to do is going back to what I've learned in life is what I can control, what I can't. So in essence, I know in the morning I can get up early, I can exercise, I can read up, I can do some LinkedIn. I know that I can make 20 phone calls. I know I can respond to my emails. So I guess it's a matter in how do we apply that practically in connectivity in the IoT space. Well, I mean, for me, it's working with organizations and being honest about what we can and cannot do for them, right? In the situation with this opioid recovery program, everything seemed to work out. We needed GPS tracking to understand where these people were going to be in case they were driving to a part of town where we knew that's a drug part of town where they can go find opioids or drugs, right? So we knew we could find that tool. We knew we could find a patch that would monitor their vitals. We knew we could solve for the connectivity. We knew we could find a purpose-built gateway through social mobile that would be usable for 3, 5, 6 years for many years to come without causing problems. So I think what happens is in this scenario, we were able to come up with the right answers. We can do that. We can find that device. We can kit and stage them. We can make sure they work. We can ship them. We can do the reverse logistics. So in this IoT crazy world, that became a solution of we can do this. Now, it wasn't visible initially, but through work and effort and a partnership with the other organizations, V1, Social Mobile, VivaLink, we were able to put the solution together. And I guess that's the most important thing I can bring in when it comes to IoT. There's a lot of things out there that may not be doable today. So my job with my partners and our organizations and customers is when they bring a problem to us, because that's what we're trying to do is solve for problems. Is it a problem we can solve for? And the most important part of my philosophy is if we cannot do it, then let everyone know right away. That's something we don't have an answer for. But do I know someone else that has an answer for it? Do I know a competitor that can do that? Then absolutely. Let me recommend these folks. They do this and that and this well. We don't. Go to them. That I think it's part of my philosophy because if we can't do it, I don't want to mislead anyone. I want to let you know right up front what we can and cannot do. And in that respect, go find the right people that can do it for you because today we're not the right solution. Now, in a year we might be, but today we're not. So I think that's part of my philosophy is just being practical in my response to customers and their needs and what we as a company can and cannot do.
Yeah. So essentially, you're saying, let me figure it out. Then I'll let you know.
Yeah, yeah. Let's work through it together.
Yep.
And if the answer is we can't do this, but if I know someone else that can, you
Here
should
we go.
reach out to them.
Yep.
And if I know them, I'll do the introduction.
That's great. As a final thought, this is a question I enjoy asking my guests. If you had a superpower, what would it be and why?
Superpower. That's a trick one. I hadn't thought of that. Oh gosh. I don't know. I think there's the easy ones of like, I would fix the world. I would find world peace, right?
Right.
Stop wars, right? Why do people kill each other? I guess in trying to think of the art of the doable of what would be something superpower. I guess, listen, problems that we come across in life sometimes are very complex. I
Mm-hmm.
think if I had a superpower where I could just see the solution quicker and faster and come up with the right answers today as opposed to give me 2 to 3 weeks or let's work on this for a month or 3 months. I think that would be a superpower that would be kind of fun. If someone could come to me and give me their problems and give me all the pieces that hurt, and I could instantly go, here we go. We need this, that, this, that. You got to go here, go there, there. Here's your solution right now, today, right now, instead of 2, 3 weeks, 4 weeks, or maybe we can't do it. So maybe that would be my superpower. I don't know if that's a valid one, but it sounds like
Yeah,
it'd be kind of fun.
it's a viable one. It's the superpower of give me the solution now.
Yeah, yeah,
Yeah.
yeah. And best of all, if we could do it all and just snap of a button, done, that would be
Yeah.
wonderful. And we can dream, right?
Yeah, we can dream. It's the dream of the superpowers.
Yeah.
All right. Well, thank you for coming on the healthcare and technology segment of Podcast Wise Perspective. And it was great getting your perspective on IoT. And I hope to have more conversations like this with you in the near future. And
Thank you so much, then.
thank you. And all of the listeners and people, our audience, I lost my words here. Thank you all for watching.
Bye, folks. Thank you, Finn. Awesome.